Welcome to NCLEX Map. Today we master one of the most critical neurological tools in emergency, trauma, ICU, and postoperative care, the Glasgow Coma Scale. GCS is a standardized scoring system that evaluates the level of consciousness by assessing eye-opening, verbal response, and motor response. It is used to detect neurological deterioration early, monitor trends, and guide interventions. A single score matters far less than the pattern of change. The objective is to recognize subtle declines before irreversible injury occurs. Begin with eye-opening, E, scored from 1 to 4. 4 means the patient opens eyes spontaneously, alert to the environment. 3 means eyes open to voice. The nurse must call their name or command. 2 means eyes open only to pain, such as trapezius squeeze or sternal rub. 1 means no eye opening at all. When the eyelids are swollen or mechanically closed, chart untestable rather than assigning 0. Next, assess verbal response, which is V, scored from 1 to 5. 5 is oriented. The patient states name, location, date, and situation. 4 is confused conversation. Speech makes sense, but orientation is incomplete. 3 is inappropriate words, random and disconnected. 2 is incomprehensible sounds, such as groans. 1 is no verbal response. For intubated or aphasic patients, document V as T or A rather than assigning a false score. Motor function is the strongest predictor of neurological integrity. Motor response, M, ranges from 1 to 6. 6 is obeying commands, hand squeeze, limb lift, tongue protrusion. 5 is purposeful localization to pain. The patient reaches toward the stimulus. 4 is withdrawal, pulls away without localization. 3 is abnormal flexion, decorticate posture, arms flex inward, legs extended. 2 is abnormal extension, decerebrate posture, arms extend and internally rotate. 1 is no motor response. Posturing signals severe brain injury and must trigger urgent escalation. The total GCS score ranges from 3 to 15. 13 to 15 indicates mild injury. 9 to 12 means moderate. 8 or below indicates severe brain injury and is associated with airway compromise, deteriorating perfusion, and elevated intracranial pressure. A GCS of 8 or less frequently requires intubation, less than 8 intubate, to protect the airway. Now apply to a clinical scenario. A young adult arrives after a motor vehicle collision. Their eyes open to painful trapezius squeeze, score of 2. Their verbal response is inappropriate, random phrases that do not answer questions, score of 3. Their motor response withdraws to pain, score of 4. The GCS is 9, indicating moderate injury. The nurse should prepare for rapid imaging, maintain spinal precautions, monitor airway, and reassess frequently. A drop from 9 to 7 signals deterioration and demands immediate physician notification. In another case, a stroke patient initially displays eye-opening to voice, speaks coherently, localizes pain, GCS 13. 30 minutes later, they respond to pain only and verbalize incomprehensibly. The score falls to 9. This decline trumpets worsening cerebral edema or hemorrhage. Trend matters more than the number, because sudden change is often the first sign of neurologic crisis. Now your high-level NCLEX question. You assess a trauma patient. Their eyes open to voice. They are confused, repeating only one phrase. They flex their arms inward to painful stimuli. Which interpretation is correct? A, mild brain injury. B, moderate brain injury. C, severe brain injury. D, administer analgesics first. Score eye-opening 3, verbal 4, motor 3, total 10. The correct answer is B. This is moderate brain injury and requires close monitoring, imaging, and airway vigilance. Analgesics may mask neurologic assessment and are not the priority. Severe brain injury is defined as 8 or less, not 10. GCS is not a number to memorize. It is a living measure of the brain's function. Every point carries meaning. Orientation, command following, and purposeful movement reveal cerebral, brainstem, and spinal pathway integrity. A nurse who understands GCS does not wait for disaster. They recognize decline early, mobilize the team, and protect the patient from silent neurological collapse.